I am walking around and I see, first ever in the history of the H.I.T podcast, multiple time guest, double guest, Dr. Hunter Vincent. You are in rarefied air, sir. How are you?
Good to see you.
Good to see you
in
too.
the flesh.
In the flesh, in 3D, man. It's great to have you on. I'm so excited for you. And we actually are not only friends, we work together.
We are colleagues now, as they say in the biz.
That's right. What are we colleagues on?
We are colleagues for the first ever Jingle Bell Run in Los Angeles for the Arthritis Foundation.
That's right. I am the corporate chair of the Jingle Bell Run, the Arthritis Foundation, and you are not only a physician by trade and a great friend to the organization, but you're serving in a capacity as well to try to bring your sort of medical knowledge, bring your business acumen, and make this run as successful as possible.
That's exactly right. But I think what we're trying to do with this partnership here is bring a little bit of the medical and combine it with a little bit of the business, right? And so the theme of this JBR, the Jingle Bell Run, is really to kind of meld both of those together. There are so many great health resources out there, particularly for people with chronic pain, chronic joint disease, arthritis.
Specifically through the Arthritis Foundation, you're saying?
Specifically through the Arthritis Foundation, and they're just not sent out to the masses.
Right.
And so increasing exposure and then bringing together, key opinion leaders in the field, particularly in insurance and in employer, solutions and things like that.
Are you calling me a key in the field there?
It's almost like we're talking about the H.I.T podcast here.
Yes,
it's almost like
H.I.T, Human Resources, Insurance and Technology, dropping every Tuesday. But we are trying to amplify what Arthritis at Work does. And we are trying to use this platform a little bit to let employers that might be listening know what are some of the things, resources, free tools Arthritis at Work provides that folks might not be aware of.
Well, so the first thing that people aren't aware of is the fact that 66 million people around the United States are dealing with joint disease and arthritis.
Yeah,
right?
Chronic pain.
But the Arthritis Foundation does a really good job of increasing awareness of joint disease in the workplace. Yeah. Just because you're not hearing about it doesn't mean it doesn't exist. Right? And so a large part of what Arthritis at Work does is increase awareness and destigmatize some of this, the pain aspects of dealing with chronic joint disease and arthritis and things like that.
Right. So you're talking about from an HR practitioner standpoint, if they even wanted to kind of lend an empathetic ear to the idea that, give or take a third of their employees might be dealing with something that in flare-ups is an 8, 9, 10 out of 10 in the pain scale. They're expected to go to work, they're expected to show up, and so literally just starting with a conversation about that.
Certainly. Opening it up, let's have some discussion, then what's the next step, right? So now what other resources do we have to offer?
Yeah.
So everything from a physical standpoint, joint health, nutrition, mental health, these are huge components, huge treatment arms, so to speak, of dealing with chronic joint pain.
Right. And so the Arthritis at Work Foundation helps employers to deliver this to employees? Yep,
it's just a plethora of free resources that are available for employees through the employer in conjunction with the Arthritis Foundation.
So we're talking a little bit about the Arthritis at Work Foundation, and we mentioned their big kind of Jingle Bell Run, which is coming later this year, which we are both involved in. If employers hear about this and go, actually that run sounds a little bit interesting, is there something I can do, send a team, sponsor, be out there, kind of what are some of the things for an employer to know at this juncture of the planning of the run?
So right now, the run is going to take place in Los Angeles in the fall.
Yep.
We're going to bring together great companies.
Yep.
We're looking for other great companies that want to be a part of this Jingle Bell Run, want to be a part of the collaboration with the Arthritis Foundation.
Yeah.
They're open to sponsorship for advertising, but in general, just open to having that discussion.
Yeah.
So whether you're part of the JBR or not,
Yep.
we're looking to create those connections with companies who want to offer free resources to their employees, addressing joint pain, addressing the mental health component of chronic pain. And the other thing too that is not often addressed, but what about families that are dealing with, rheumatoid arthritis, juvenile arthritis, some of these more autoimmune, types of arthritis?
Yeah.
These are very, very difficult diseases that require a lot of care, a lot of touch points, medications that are not often available or readily accessible. So the Arthritis Foundation can help find providers to give out those resources, find providers that treat rheumatoid and treat these inflammatory conditions.
And again, you say this as a practicing physician, right? So you're not just reading newspaper headlines.
Correct. No.
Yeah. Within what the Arthritis at Work Foundation sort of brings to employers, and even kind of zooming out from a claims standpoint. So when you're talking about the joint issues and potentially the path to either surgery or other treatments, for employers that have to fund their healthcare claims, there are going to be more or less expensive tracks that claim can go down. Can you talk to me a little bit about intervention and the different options and different philosophies that physicians might have?
Certainly. I mean, you can think about it as simple as pre and post surgery, right? The goal is to not have surgery or to avoid that kind of post era, right?
Yeah.
So when you think about free resources and things that you can do or interventions you can do earlier, right, from an exercise standpoint, nutrition standpoint, conservative management of joint pain, these are things that if you implement them early in the life cycle of an employee or the disease, right, you can hopefully prevent or forego that post, knee replacement or knee surgery phase, right? Now, if an individual has the knee surgery, let's call it knee or joint surgery, what can we do to then prevent chronic pain from worsening?
Yeah.
Right? How can we help someone have a normal post-operative, time period?
Yeah.
You get the surgery, you recover, you get strong, you go back to the workforce, happy.
Yeah.
Right? I would say fat and happy, but we'd like them not be. We'd like them to not be fat, right? Anyways, but so by implementing these conservative resources and conservative care and support, really, you can help an individual either avoid the surgery altogether, or you can really make a smooth landing after the surgery. And I think that's where some of the costs for employers come in.
Yeah.
Right? Because care can get complicated.
Yeah.
You can have side effects. You can have poor surgical outcomes. This is going to lead to other hospitalizations, ED visits, medications, all of the above. Those add up.
Yeah. And in addition to your role, not only as a physician and with Arthritis at Work, but you have another passion project trying to help folks avoid that kind of post-surgery world when and however possible through Pogo.
Correct. So with Pogo Health, we're a medical cost reduction strategy dealing with chronic pain and mental health in the workplace. So we try to bring multiple providers in to create that level of support for individuals in the workplace that are dealing with chronic pain. So whether that's with mental health therapists, health coaches, clinical psychologists, physician oversight, right? We bring together all these resources to create the structure to help an individual that's dealing with chronic pain, help them live and thrive in that setting.
Yeah, I love that so much, man. You are such a resource to the community and such a blessing. Like when you talk about arthritis, I think we, and joint pain, we get an image in our head, but then you mentioned the juvenile arthritis, you mentioned some of the rheumatoid stuff, and the numbers, right? The 66 million people dealing with this stuff. So it is so much more, I think, bigger and hairier than we think about. So folks like you out there tackling it is awesome.
We try. I mean, it's bigger than people think.
Yeah.
And honestly, if I got to get on the podcast every week and talk about it, I'm happy to do it.
You're welcome every week. You do a shout out on the intro and the outro to the sponsors or something like that, and just give us a little bit on Arthritis at Work. You're welcome.
Done.
Appreciate you, man.
Thank you, man.